Hi, this is Dr. Stu Currie with MojoFeet, here to talk to you about the Mojo Matrix pin system from a big picture perspective. This video is for docs, office staff, people who are new to the Mojo Matrix system, people who already have one in your office, but you want a big picture reminder of what it is this system does, how it's different from other systems, and what the advantages are, right? So I'm going to walk you through some of the big picture things that I'd like you guys to understand. It's good for you to understand this so that you can explain to your patients why this is different and what we're trying to do here, right? So the first thing that we need to talk about is the fact that the Mojo system captures the foot in a 3D posture, right? This is three-dimensional, volumetric cast of the patient's foot. It takes that 3D information and sends it to the lab, right, in a three-dimensional format. That's number one. But probably more importantly is the fact that we are also capturing a corrected foot posture, right? This differs from other systems out there in that I need you, right? The office staff, the docs, are taking the foot, correcting it, capturing its idealized foot posture, its position that we have it in ready for heel strike, and then sending that to the lab to be made as an orthotic. This differs from other systems out there that use full weight bearing, standing positions of the foot to make an orthotic. So in my opinion, making a three-dimensional corrective device off of two-dimensional fully weight-bearing positions is not optimal, right? And that's not what we're doing here. So what we're doing is capturing correction and sending it to the lab in a 3D manner. So those are kind of important concepts to understand. If a patient's in front of you, right, they may be wondering, should I be getting these on Amazon? I remember, doing something at my other doc's office, at my other healthcare provider's office. I wonder if I should be looking at that. You don't need to know all of the different systems out there. If a patient is asking you about other systems and what the difference is, ask them a question, right? Ask them, were you standing on this system? Did you stand up? Did you walk across a plate? Were you standing in foam if it was foam? All of those questions, or that question, will give you answers that'll lead you down this road of, okay, that's not what we're doing here. I'm going to position your foot in its ideal position, and we're going to make an orthotic to where your foot should be, not to where it is, right? Because if you have a foot problem and you're only capturing that, you're capturing the problem and not the solution. So as a summary here, we're not doing 2D, we're doing 3 dimensions. We're not capturing pathology, we're capturing a corrected foot posture. Other systems that are not corrective out there, capturing fully weight bearing, this is corrective. And this is not something that you can go stand on at a big box store, right? This is only through healthcare providers and docs. So a picture is worth 1,000 words in my opinion. And if we look at two different orthotics that were made from the same cast, but made by different orthotic companies, I think this is going to illustrate where I'm going with this. So this is an orthotic, not a Mojo orthotic. The bottom one is a Mojo orthotic, right? So this is a Mojo foot custom orthotic on the bottom. I've outlined the arch profiles there for you, but to illustrate the point, these are actually made from the same corrective foot cast. So the same arch was given to two different labs, and you can see the difference, right? This is just differences in manufacturing, right? Based on a fully corrected position. So I think that will help you understand why and how what we're doing is different. I use the eyeglasses analogy to kind of wrap this up for patients, right? In something that they can kind of understand. Price in the orthotic world doesn't dictate quality. So you can go out and you can spend $500 to $1,000 on a pair of orthotics. That unfortunately doesn't tell you how good they're going to be, right? So the analogy I use is like eyeglasses. You can go out and spend $500 on eyeglass frames. But if the prescription for the lenses is wrong or not corrective, then what good are those glasses? So that's kind of similar to the orthotic world, right? You can go out and spend a lot of money on orthotics, but if the prescription, if the corrective foot posture isn't correct, then how good are the orthotics going to be? And most people kind of understand that concept, that it is the prescription that's the important part. And that's what I need you guys for. The other big picture thing I want to talk about, aside from the correction, is the fact that this is a screening tool. So this is designed to capture information on all or most of your patients. Some of my customers, some of the docs out there, use this as an orthotic ordering tool. So in other words, they've identified already clinically through other means that this patient needs a foot orthotic, and they use this to order an orthotic for that patient. That's great. That works. But I might suggest that there's some missing information there. You're probably missing some people in your office who may need foot help. Now, to be clear, that foot help can come in the form of orthotics, either prefabricated or custom, but it doesn't have to be, right? All of the other tools that are at your disposal are in play here. Scraping and taping and manipulation and mobilization techniques and all the other modalities that you might have to treat a foot are in play. But what this system is designed to do is help you decide how bad off somebody's foot is and whether it might be part of the problem. So for each foot, we're going to take 2 casts. We're going to take a cast in the corrected posture, and then we are going to have the patient stand on the pins to see where they're at, right? Where are they living, working, and playing as far as their foot goes, and how does that compare to where they should be? The difference between those 2 positions gives us an idea of the amount their arch collapses between correction and full standing. And the system will then spit out some percentages and numbers to give you a clue about what might be going on with that patient's foot. So we have it in some categories, right? So we have a normal. There should be a normal or an ideal or a category where you might look at this foot, it might be collapsing to a certain degree, but pronation is normal, right? So we got to remember that pronation gets a bad name, but it's only when we do it too much that we start to run into the problems. So pronation is a normal part of the gait cycle that helps us shock absorb. That and the various flexions in our ankles and knees and hips are what transfers that downward momentum of our body into forward momentum. Pronation is part of that and a normal process. So we want to identify normals, right? So if they're in the 20 to 30% of arch collapse, that's probably good. We have these other categories as well to kind of tell you, is it yellow? Is it yellow warning zone, caution kind of thing, where we might want to pay attention? Maybe we may send this patient away for some active foot exercises for a few weeks and see how they're doing. Or is it bad enough that they're probably going to need some correction and control? That's what this system captures. And what I suggest in order to capture this, in order to fully take advantage of all this, is to systematize this. So what I mean by that is pick your subset of patients that are going to get scanned. I'd say probably half of the docs who use us just scan everybody, right? It's part of the protocol for determining what's going on with a patient. Just like an x-ray, it's going to give you information that you might not otherwise pick up. So scanning more rather than less is the way to go. There's no harm to this, right? We don't charge you for it, nor is there any harm to the patient. So by that logic, it's a tool that can be used as a screening tool. The other option is to pick some subset of everybody. Let's call it everybody with foot, knee, hip, and low back pain. So those subset of patients will automatically get a foot scan, right, when they're in your office. When you pick one of those, and honestly, it varies clinic to clinic. You guys can choose what you want to do with that. but pick something and stick to it. What I would advise is you not leave it up to an individual decision on any given individual day, because we all get busy, we get overwhelmed, and it's easy to put off. But I do suggest you systematize it, put it in as part of your protocol for evaluating a new patient, whatever your criteria are, and stick to it. So those are the two big concepts. You're going to understand what you have and that it's a corrective foot posture, and you're going to systematize it in your office. With those two concepts, you can be successful in helping more people with their feet. That's all for this video. Stay tuned for more on the different protocols we use to evaluate a patient's foot and what some of these numbers might mean.